we're moving on to the panel discussion, and we'll have some open questions. So applicants, please put in your questions through the Q&A function of the Zoom. As we wait for some questions to funnel in, our panelists, do you have any pearls, any words of wisdom for the incoming applicants, things that worked well, things you know now that you wish you knew back then?
I can comment. I mean, Dr. Wohlauer, I'm from Colorado, so clearly we work together. I mean, me getting in was a little different. I was kind of I was in the general surgery track, and then I was doing research and ended up switching in as we opened up the program. So I don't have the same experience, interviewing wise, but I could say that, the best advice I guess I could give interviewees is, one, I definitely agree with what was said before. You want to make sure that like the people you meet, like you can connect with, like, the conversations you have, the other fellows there, residents, whoever you meet on the interview trail at the particular institution, are these people you can, that you get along with, similar interests, someone you'll be talking, you could have a conversation with because you'll be seeing a lot of them. And there'll be some of them who you're speaking to will be your mentors. So in a place that you go to and, you're not really getting those vibes for some reason, I mean, cross them off the list, unless there's some other very specific reason that you want to be there. Two, I would say, if you have a particular interest in, in vascular that's more specific, the places you're at, find out if they're doing that. If you want to know, complex aortic work, thoracic work, are they doing that? Or if you want to do something different, also you got to find out, is the program you're trying to go to going to give you those skills, because you don't want to end up finishing your however long your training is and realizing that you may not have gotten the experience that you wanted. And so those are kind of the tidbits I would say.
Great.
I'm Lorela from Loyola. I would say something I learned after I started residency was this idea of you have both mentors and sponsors. So the idea of sponsorship, it's going to be someone who is going to vouch for you and advocate for you and put you in roles that you normally would not be able to maybe get on your own. Such as being a panelist at a big conference, or I mean, there's a variety of committees that you can be involved in. And this is just I mean, you think you're going into residency to learn how to be a surgeon and just the vascular pathophysiology of it, but it's really going to help grow you as a person, to be involved in all these different aspects of the vascular community. And so looking at each program, I think, is going to have people who are really involved at the national level or regional level, and maybe just seeing if they're involved in roles that you're interested in, I think could be really helpful.
Thank you, Dr. Weise. We have our first question trickling through from Ye Rim Park. What were some questions you asked programs that helped you figure out their vibe?
I think I can start off with that one. Hi, everyone. I'm Eric Pillado. I am a integrated vascular resident at Northwestern. We have 2 years of research. So I'm a PGY 6, I guess, but clinical 4. I think the big thing is I moved to a city that I'm not familiar with. I've never been to Chicago. I'm not from the Midwest. So I think it's true to be very authentic on what you want professionally as well as who you are personally. And so I think one thing that I see happen with applicants is that they don't necessarily talk about their what excites them about life, their hobbies, their interests. And I think, you realize that residency is very difficult. You're going to be here for 5 to 7 years. It's going to consume a lot of your life. So it's important to be upfront kind of what you care about. And I think based on that, I think when everyone talks about what are the vibes, I think that's when you realize if the vibes are on or off for certain places. So on that note, I think I was very focused on a certain geographic region. And during the interview process, I think I was very surprised, good and bad, on certain residency programs. So some places where I never thought I would interview or want to interview, and I go there and I was very shocked because of how supportive the staff were. So don't just assume things based on a region, a city, or even like what you think of an institution's name is historically.
Excellent. And next question, with geographic preference being new to you, ask, how do you think it'll affect program preferences in choosing an applicant? Does not having a geographic preference affect you negatively?
I could maybe talk about that. So I'm originally from the South, and I had kind of a unique situation where I think a lot of programs assumed that I would be unwilling to leave the South whenever I was looking and whenever I was interviewing. So I don't think not having a preference will impact you negatively. I think it means that for a lot of programs, you're not necessarily set on being in a specific area. If you interview somewhere, it won't take you off of that list. If you specify that you'd like to be in another geographic region. I think if anything, it might help you not to specify unless you are specifically trying to think that you're going to be really wanting to go there. That being said, if you're I'm dead set on ending up in a particular place, to specify a specific region that you're
I think maybe it may just be me, but Dr. DiLosa, you're kind of cutting in and out.
Unless it's for to be closer to family. And that's something that you should probably
And thank you. What, and then two more.
During the process of interviewing.
Some little bit of a tough.
Oh, sorry.
Kind of breaking up there towards the end. I think we got the gist of it. And please follow up with Dr. DiLosa when you visit the UC Davis breakout room or send her a chat. Two more questions. We've got a couple minutes and these are all excellent and we can address these during the residency fair as well. So what was your major challenge when choosing a residency program? And then for the residents, how should you take an interview that felt scripted and unpersonable? While at the pre-interview dinner, the residents were very friendly and welcoming. Blake is going to answer that one. So maybe we can answer the first one live as Dr. Murphy answers the second one. What was your major challenge when choosing a residency program?
Hi, I'm Lorela from Loyola. I think for me, it was well, I was part of the class that did virtual interviews. And so even though they might have felt long in the moment, it's only half a day of getting all this information about a program. And so, trying to make an educated decision about what program would be best for me, I felt like I was really getting caught up on details that in hindsight weren't as important. So I was looking for red flags. I remember thinking, oh, this program doesn't, the residents don't write the opt note. That can't be good for training. And like in hindsight, looking back, all these programs would have really been wonderful training, and those little details don't necessarily make a difference. So I think talk to your mentors about what truly is a red flag and what might affect your training versus what's not necessarily a big deal.
Excellent. Thank you everyone for participating. We're going to move on to the residency fair. If anybody has questions for our panelists and speakers, message them directly. We can get their emails out so that you can email them or join them in their virtual breakout rooms for their residency fair programs. Okay.
This is Angela. I'm just going to chime in really quick. I've got MedStar on the phone right now that their link might not be working. So we're trying to get a new one and I'm going to email it out. So if you're interested in MedStar, be on the lookout for another Zoom link. It's not working. And if that happens, just keep an eye on your email if this happens to anybody else. Thanks, guys.
Thank you.
Okay, so email me.